Hello, this is Cal with Custom Insured, and thank you all for joining today. We wanted to put together a video to help further clarify how we're able to lower premiums for businesses by up to 30% while giving better networks and lower deductibles. The truth is, it's not too good to be true. We're sitting at the pinnacle end of a market transition of Obamacare that happened back in 2010, and the goal was to show all the different steps or all the different events that led up to this opportunity for us to introduce these services into the market. I personally have been writing health insurance for the last 5 years, so I'm very familiar with the Affordable Health Care Act, how it comes together. So we tend to take that as second nature when a lot of people don't really understand all the moving parts that are causing all of these pricing shifts, all these huge renewal increases, all these limitations in coverage that many out there are seeing. So what we want to do is kind of show step by step how this all came together. So ideally, we're speaking to small businesses that may be an independent contractor up to 40 or 50, even above 50 employees in a business. So that's who our primary target market is that we're working with. However, everyone else, please continue to watch on. I promise you, you'll learn a lot more about what's happening in the healthcare market and where we're at today as you did beforehand. So with that being said, just want to kind of get the disclosure, so to speak, out of the way and take the next step in explaining how our coverage is not too good to be true and what's really happening with the pricing and what's in the direction that we walk in the door with. Once again, it's all reactionary to a market that's kind of out of control or broken, so to speak. So our approach provides superior options for group health plans, and it does without a doubt. Just because of the way the market has changed, changing regulations, etc. So we'll be addressing all of that in this video. First and foremost, the changes that led to the formation of the ACA or Obamacare or the Affordable Health Care Act. What caused that to happen? What caused the change of law and where we're at today. And then, of course, how the ACA became broken, how the network shrunk down, how different health insurance companies stopped offering coverage to individuals because the costs were so high. We'll discuss the ins and outs of the mandate penalty and, of course, the opening that the market created for our services and how that translates to helping small businesses. And of course, none of this could have happened without some significant changes of regulation, which we're going to address as well. And then after we understand how this all came together and the layering, so to speak, or the step-by-step approach of the market that allowed us to enter with the plans that we have today, we'll show you how our customized solutions are better than the traditional approach and how we can save businesses some serious money moving forward, along as providing better coverage for all employees that you have. Now, we're also going to show how we can eliminate liabilities brought on by excessive claims, the whole concept of controlling costs, so to speak. And, above everything else, how we can implement a solid plan with better coverage, how the market's allowing us to do it, and why we make the moves or why we take the approach that we do. So without further ado, let's kind of take a look at what happened with the conception of the Affordable Health Care Act. The Affordable Health Care Act came into play in 2010, and the law was designed to make sure that no one was left behind. There was some individuals that unfortunately were very sick and they did not qualify for coverage, and in a lot of ways they were kind of being kicked to the curb, so to speak. So it was an issue that needed to be addressed. There was other factors that led to the Affordable Health Care Act as well. We're not going to discuss those factors for purposes of this video. We're trying to make a direct correlation to group health plans, not outside hospital administration practices, etc. So for our intents and purposes, we're going to focus on group health plans and premiums and why everything's expensive or why the premiums are so high, and then of course the solutions that we offer. Now, all applicants have to be charged the same rate regardless of health. So, a lot of people still don't really fully embrace this concept, and it's not one that's echoed a lot out there. It's one that you have to understand how it comes together. And if you're in the field all the time, you're meeting with businesses, you're meeting with individuals, it's very clear how this comes together. So, with the Affordable Health Care Act, you get the same rate whether you're healthy enough to run a marathon or if unfortunately you're fighting a catastrophic disease. There is no fluctuation, so that it's all or nothing for everyone moving forward. I always look at it as a one size fits all approach. So they're going to give everyone the same coverage, and they're going to extend that same coverage through what they describe as minimum essential benefits. Some of the minimum essential benefits, without dragging it too far out, is pregnancy coverage, drug rehabilitation, not turning one down for any, or not turning anyone down for any significant health issues. So you have to follow all these different rules before you become ACA compliant. In other words, before the health insurance coverage is deemed Affordable Health Care Act compliant. So this is very important here. Now, all carriers who did not participate with the Affordable Health Care Act at the beginning of the conception of Obamacare back in 2010 were all deemed supplemental, and therefore their plans were not deemed compliant. So this is pivotal, if I'm saying that right, as far as what the end result will be and where all the opportunities came from. Truth be told, there was a few different insurance companies that had a niche market where they were working out with rural areas, farmers and ranchers. If the majority of their insurance was, say, Medicare based for Medicare supplements, or maybe they worked with disability and they had sidelines or side products of health insurance that were affected by the Affordable Health Care Act. Now, to be clear, all the major giants jumped on the law right off the bat. So, Blue Cross Blue Shield, Aetna, Humana, Scott and White, United, etc. Those were all the companies that still do offer the affordable healthcare plans today, and they have been offering those over the last 8-9 years. So, they all extend the minimum essential benefits, and very rarely, if ever, will they check anyone's health. So what that means is it's kind of the same conceptually as if the government told all the citizens out there, everyone's guaranteed an X death benefit for their life insurance, but we're not going to check anyone's health. Well, it's no secret that premiums would skyrocket because the amount of death claims paid out over the next few years would be much, much higher than it's ever been, which would expose the insurers offering this plan. It's a very similar concept to what's happening with the Affordable Health Care Act today. So, as prices started increasing because they don't do any health checks, there's no way to control the costs, they decided to implement what's called a mandate tax penalty as a means to kind of strong arm people to keep the course, so to speak, to fight the good fight, to be able to not abandon the plan just because the premiums are going up. Unfortunately, the citizens did not respond that way. They still decided to bail on the plan. There was less and less people going with healthcare.gov or going through a group health plan just because they couldn't afford it. There was a lot of small businesses shutting down their plans because the premiums just got too expensive. So it was kind of a vicious cycle, and they tried to put the tax penalty in there, which we'll discuss in detail a little bit later. And then last and not least, costs are controlled business to business, favoring larger companies. So when you're offering a group health plan, the way it works is your prices are typically the same walking in the door. However, the more employees you have, the safer you are from price increases, because the risk is assessed to a business to business basis. Meaning, if you have 5 employees and one gets sick, the costs are looked at. Well, how much money are we bringing in from the other 4 employees, and does it cover the claims? Typically anything under 10 to 20 employees. If a employee ends up getting sick, especially catastrophically sick, everyone in that office is going to take a huge price increase, because that's the only way to control the cost, to adjust the premium based on how much they're having to pay for that group or that business. Whereas if a business has 100 employees, they have 99 employees to offset each person that gets sick, etc. So there's a lot more premium coming in the door to offset that risk or that cost. So when it's favored business to business, the employers with less employees end up getting hit harder with the way the playing field is set today. And once again, it was a step-by-step approach that caused all this. Nothing happened overnight. This was all over several years, which created the solutions that we can offer today. So to give you kind of an idea of how the costs spiraled out of control in the Central Texas area, here's a video that we'll take a quick break on to be able to really explain how premiums go up when someone becomes sick, or what the exposure, so to speak, that employers have when there's no health check up front, and what's happening with the entire system. So here we go.
Today, with the ACA Affordable Health Care Act, there are no health checks to set up coverage, meaning if you are sick or healthy, everyone pays the same rate. Because of this approach, there have been massive claims resulting in hefty losses nationwide. When offering ACA solutions, the only way insurance company can stay afloat is to increase their premiums and deductibles, while shrinking their networks down to HMOs. Over the last 5 years, the average price increase in Central Texas exceeds 25% per year. However, companies like Custom Insured do health checks to make sure they can control their costs, meaning if someone is really sick, they may not qualify for some types of coverage. Everyone else in good to moderate health would be eligible. Because of the health checks at Custom Insured, there has not been a need to raise premiums or deductibles, as they have not exposed to excessive claims.
So with that being said, we typically approach businesses with two options. We look in there saying you have employees that need ongoing health coverage, and then you have employees that want to protect from the unforeseen. This was a video showing how we protect employees from the unforeseen that do not require the ongoing coverage. Make no mistake about it, we will never leave an employee behind for health issues. They will also have awesome coverage. So to put it another way, when doing business with us, we can show you how to give your employees even better coverage than they had before, while at the same time saving money, which we're going to address all those moving forward. So moving along, let's take a look at the introduction and the elimination of the mandated tax penalty. So it's important to understand, as prices started increasing, a lot of people wanted to jump ship. So what they did is they went ahead and implemented a tax penalty in 2015 to kind of strong arm individuals and companies from fighting the good fight, so to speak. This mandate was put in effect to make sure that the plan that that everyone carries was offering minimum essential benefits. The goal, of course, was to keep people paying into the system that would hopefully offset the mounting claims that was causing the premiums to rise, that was causing the deductibles to rise. Once again, there was no way to control the costs except for increasing the premiums. So they put this in effect to make sure that people did not jump ship. I kind of had the reverse effect. A lot of people kept on jumping ship. A lot of people went without insurance and just said it's cheaper to pay the penalty than what it would cost me to get coverage. I remember seeing dozens and dozens of statements of premiums going up as high as over 60% from 1 month to the next month, and of course at the end of the policy year. So I do remember this vividly, all this happening, and they felt like they were stuck because they'd have a huge penalty if they didn't follow suit with that. So That caused a lot of turmoil in the healthcare market from 2015 to 2017, where President Trump issued an executive order to eliminate the mandate penalty, which caused a kind of a bickering with the IRS. The IRS didn't really jump on board with that until later, but the point was is that the end of the Affordable Health Care Act mandate was right around the corner. In fact, in 2019, the mandate penalty was upheld. However, to appease both sides, Republicans and Democrats, they reduced the penalty to $0. And of course, imagine that, deemed it a political victory for both sides. So now the mandate penalty is still upheld. They still want you to have Obamacare, the Affordable Health Care Act. However, there is zero penalty to go anywhere else. So it's kind of on your own accord. You're not muscled into staying with the same plan. That created the end for us to be able to offer our plans to employees out there, because now if they decide to take another plan outside of the Affordable Health Care Act, they don't have to worry about any financial penalties coming around the corner, and the employer loves this because it gives employees better coverage with, of course, lower premiums, which we will get to shortly. Now, once again, this is the first year that businesses with under 50 employees can look for other options outside of the Affordable Health Care Act. That created the window and the means for us to approach small businesses. So we just happened to take a step in the right direction, or the way the market surfaced, it allowed us to come in with the plans. If you remember earlier when I was discussing insurance companies, there was some insurance companies that never jumped on the Affordable Health Care Act, therefore they never stopped doing health checks. What does that mean? It means that they lost a lot of their policy holders to the Affordable Health Care Act. However, they were never exposed to those claims because they always checked the health up front. And they were able to survive because they had other lines or other products they were focusing on, like Medicare, disability, etc. Now, most of those insurance companies today, and I would say over 90% of them that did not jump on the Affordable Health Care Act, are out of business today. However, the ones that are still around can offer much better pricing, and we found a way to implement that for small businesses where everybody can win. So please keep that in mind. Once again, this is an evolution over several years that surfaced all of this. We never envisioned any of this happening a few years ago, but here we are today. So moving along, this is what we typically show most of our plans, or most of the small businesses that we meet with. Now understand, 99.9% are on option number 1, which is the Affordable Health Care Act. Whoops, let me go to the previous screen here. So 99% are on the Affordable Health Care Act. And what are the pros? The pros is that anyone qualifies, and coverage can be good as long as you're in network. Well, the way the Affordable Health Care Act works today for businesses is that your coverage is in network if it's in the state that you bought the coverage from. Meaning if you have an Affordable Health Care Act plan that was originated in Florida and that small business moves to Texas, you're going to need to redo the plan to be Texas compliant. Okay, so your coverage is only as good as the state that you set it up as. Otherwise, you're going to have higher co-pays because you're going to be out of network, which we'll discuss on, we have discussed on our podcast and other videos coming up. Now, the cons of having an Affordable Health Care Act is that most of them are reduced to limited PPO networks or HMO networks, which those of you who do not know, an HMO network is a very condensed version of a PPO. Now also the deductibles can start off as low as say $1,500 and go all the way up to $10,000. Truth be told, most of the plans have a higher deductible than not, once again because of the excessive claims, because there's no control costs. They're not checking anyone's health. Now, another issue or another side effect is that large premium increases can exceed 30%. Now, that's more on the individual family side. On the group health side, a company like between 10 and 20 employees is usually going to average anywhere from 10 to 15, maybe 20% rate increases per year, and they have been experiencing that over the last couple of years. There's also open enrollment limitations, meaning they only want you signing up and adjusting coverage once per year. If you decide to get out of the plan, that's it, you're out, you're not coming back in. We call that open enrollment. There's open enrollment periods for individuals and families through healthcare.gov, and there's also open enrollment limitations set in by your employer depending on what month of the year they set up their open enrollment at. Now, there's usually minimum enrollments required. So when a business wants to bring on a a group health plan with the Affordable Health Care Act, what they have to do is at least 80% of the employees have to sign up for that plan. If less than 80% employees sign up, there are a couple of exclusions, but for the most part, you're not getting in the door with that. You have to have 80% participate. Now, typically what happens is when a small business goes into a plan, after the first renewal the prices go up, half the employees end up coming off, which means you started with 80%, but on year 2 you only have 40% participating, and that number kind of tends to dwindle down as time goes on. Now, this is killing small business employers because their employees are now being recruited by other companies that can offer better coverage for them. They can't sustain those huge costs because there's limits on the profits that they have being a small business, so they end up losing employees going across the street. We can help stop all of that, which we're going to get to here shortly. Now, on the private side, these are all the plans that became available after January 1st, or the plans that still do the health checks up front. So in our experience, when we walk into a business, about 80% of the employees do not have ongoing health concerns. They don't go to the doctor more than maybe once or twice a year. So what we do for the company is that we can extend this coverage to those employees while enhancing the coverage for those who are ill or have ongoing medical treatments, which our goal once again is to increase everybody's coverage moving forward while lowering costs. So let's take a look at the pros. There's low or no deductibles because there hasn't been a need to increase deductibles because they haven't been exposed. They've always checked the health. There's no issue on controlling their costs. Number 2, unrestricted networks. They can go to any doctor they want nationwide, and even if their doctor is not in network, they can still have up to 100% paid for it, which we can show you how all that works. That's a different conversation for a different video. And of course, control costs. So not everybody may qualify for this, but it's still very lenient. So if someone's got high blood pressure or high cholesterol or even both, we can still work with that. However, if someone fought a major disease within the last couple of years and there may be ongoing health concerns, that's going to be more of an employee for the Affordable Health Care Act side, not the private side. So we tend to offer 2 coverages for the people for the employees, depending on how they have it all set up. Now, the cons, of course, not everyone may qualify. Those with very significant health issues, whether it be issues stemming from a bad back, maybe there's ongoing severe arthritis where the medication's very expensive. Those would be more on the Affordable Health Care Act bucket, with other options added on top of it, which we can discuss in a different video. And everyone else who doesn't have the ongoing health concerns can in turn protect themselves from the unforeseen with much better pricing than what they're offered right now. So taking a step to the next slide, this is how it typically comes together. Now, if you remember, Group Health 1 was the Affordable Health Care Act that we discussed about, and this cover is designed to embrace and enhance ongoing medical treatment, providing superior coverage for the employee's ongoing needs. This is also the best bet for pregnancy coverage. It gives the employee more support for prescription drugs, long-term medical needs, or ongoing treatments, whatever those treatments are. The other bucket, the option 2, is designed to eliminate the out-of-pocket expense in those to good to moderate health, focusing on what might be coming around the corner, not what's happening month to month. So premiums for this are much more attractive since they always check the health up front. These premiums are much more affordable, which can save the company a lot of money while lowering deductibles to the $0 level and covering the basic needs of the employees at a much better better situation than they are currently in right now. Now, medicals from this coverage, of course, extend coast to coast, whereas Group 1 is going to extend state to state. Now, the law of averages, typically 80% of the employees will fall in option 2 and 20% will fall in option 1. And that's just how the law of average happens. So we never leave anyone behind. We can add extra coverage like home rehabilitation to the other 20%, giving them better coverage than they had before. A lot of times much better accidental coverage as well. The point is that most employees will choose option number 2 because they don't have ongoing health concerns. And imagine what would happen if we could drop your premiums for 80% of your employees by up to and over 30%. What would that look like if you had over 15 or 20 employees? At that point, you're probably saving 6 figures a year that you're putting right back in your pocket, and your employees have very sound coverage moving forward. So that's how we put everything together. That's how we put that's how we structure the plan, so to speak. And once again, why? Because over the years, when they took away the cost controlling elements, these costs have continued to rise. Employers and families alike were muscled into keeping those high premiums with over the years, with the fear of a tax penalty. Now the penalty's gone, so you can go wherever you want. There's insurance companies that haven't been exposed to that. That's going to make it a much better fit for the company's needs and the employee needs moving forward, allowing you to retain that talent moving forward without them running out the back door. So moving along, a closer look at our group health plans. Everyone in your office is going to have this kind of coverage. They're going to have an umbrella type based package, catastrophic accidental coverage with hospitalization and surgery, outpatient preventative coverage. This covers everything from optional add-ons like home rehabilitation, inpatient, outpatient surgeries, MRIs, CAT scans, lab tests, up to 8 to 10 visits a year. Typically, most of them on the private side will have 4 visits, whereas those who are on the Affordable Health Care Act side can have up to 30 or 40 visits a year, depending on what their situation is. Of course, all this coverage comes with preventative coverage as well, pap smears, mammograms, colonoscopies for those over the age of 50 years old, and of course prescription drug coverage. And just like pretty much all of the plans out there, you can have your choice to add on dental and vision coverage, which gives you all the other benefits here as well. Now, depending on what bucket you are, we may have several versions of group option 1 and several versions of group option 2, depending on the budget or what you're trying to offer to your employees or how much premium you're paying towards your employees' plan is all going to play to give the final balance. But over everything else, we wanted to let you know that we're able to do offer the plans that we have, just because this evolution of Obamacare has caused premiums to skyrocket to record levels the U.S. has never seen before. So now, because you're not strong-armed into a penalty, we can redirect all of that back into your pockets while giving your employees premium plans. Now, to be clear, our private plans are very, very strong. There are some private plans on the market that we wouldn't offer our worst enemy that coverage. Our plans can typically pay easily over $500,000 a year for diseases. We can pay up to $1 million and over $1 million a year. It's very comprehensive packages that we offer. All the plans are, excuse me, all of the insurers or the insurance companies that we recommend have very strong ratings. They've been around for multiple decades, and they have a very solid track record, so to speak. So that's how we're able to walk in, show you how you can lower your costs because that mandate penalty went away, because you're not forced to be pigeonholed to huge premium increases. Which brings me to another point. We talked about renewal increases. On the private side, so 80% of your employees now are not assessed on a business to business basis. Rather, they're all combined in one pool. So moving forward, let's just say 5 of your employees become very sick on the private side. You're never going to, none of the employees will ever pay one extra penny in premium because of that. Why? Because the costs were already controlled up front when they did the health check. That's the key, control costs on that. So with that being said, this brings us up to a couple of follow-up questions about what we really do for everyone else out there and how we wrap this all up. So what's the best plan for your group health needs? Number one, unlimited networks. We have expanded PPO availability. We never had to lower or shrink our networks. Another way to look at this is it's pretty much guaranteed. If an insurance company is losing money, a health insurance company, three things are going to happen. They're going to raise deductibles to help bring more money in to combat whatever's causing them to lose money. Number two, they're going to raise premiums. And number three, they're going to shrink down networks so they can control the costs. Now, there's long explanations for each of those items. If you want more information about what each of those items means, reach out to us and we'll get you more information. But for the most part, we can offer expanded PPOs, usually through a couple of different networks, protecting every employee that you have, under your business. First dollar payments are on most all claims with no deductible. Once again, we can do that because we haven't had to raise the deductible. There hasn't been a reason to on the private side. And of course, no minimum. You can either have one employee participate or you can have all your employees participate. So we can offer the private side, extend that to what we call a side-by-side. So let's just say you have a plan that you have right now, and we can go in there and say, hey, does anyone want to be on option B or bucket number 2, which is the private plan? And when our experience, 70-80% of them will move over to that plan, which will lower the premiums by about 20 to 30%. And of course, we can customize employee options to meet any time or meet their needs any times of year. So we're not forced to wait until next year to make any changes. Now, if you want to operate your business that way, that's fine. If it's less of a headache, just understand we can make adjustments throughout the year to whatever you want to add on. We can add more coverage on, we can take coverage away, we can adjust it for you. And then last but not least, eliminate all future renewal rates for use of coverage. Because we pull everyone in one bucket, not business to business to business, your other employees are never going to be exposed by the price increases of those who may become sick or have a significant accident. That is huge, which means you're going to be able to keep the same plan, to keep the same extended networks, and be able to keep offering those plans to your employees, offering them superior coverage to what they could get across the street with the larger company. So that's the true power of control costs and why it's not too good to be true and how we put this together. If you want more information on how all the angles come into one spot to create that market, feel free to check us out at custominsuredgrouphealth.solutions. That's how we're able to do what we do, is because of a rising price increases, number two, a change of regulation to take away the mandate, which gave people more options as of January of this year. So yes, we can save you incredible amount of money for most businesses out there, while giving your employees a much better coverage moving forward, which is going to retain your long-term interests. So, any questions, please feel free to reach out. You can, there's several ways to contact us on that website. My email address is calb, as in boy, at custominsure.com. Thank you for listening, and thank you for your time.